Hello, I'm Dr. Stile. A Brazilian butt lift, or gluteal enlargement using fat, is a cosmetic surgery procedure that transfers living fat from multiple areas of the body to the gluteal region, or rear end. This procedure benefits patients in many ways. It can enhance the shape and increase the overall size of your buttocks, or lift and fill out rears that have sagged from weight loss or aging. The procedure itself takes approximately 3 hours. During the procedure, fat is harvested from 4 to 5 areas of your body, usually the abdomen, flanks, inner and outer thighs, and sometimes the upper back and arms. These areas are left with a thinner, improved, leaner, and more feminine contour. A thin waist is the goal. The fat is then processed and strained. It is used to sculpt your fabulous new rear. After you are fully recovered, you will be discharged home. You will be sent home wearing a support garment. The garment will help shape the contoured areas while minimizing pressure on your newly enhanced rear. You'll need to wear the special liposuction compression garment for 4 to 6 weeks following your surgery to manage swelling and protect the surgical sites. Once you are home, you are required to rest and sleep in the prone position. This means on your belly. You should get out of bed every 2 to 3 hours and walk, being certain to flex your calf muscles. Be sure to take your medications as directed. On the first day upon awakening, you can remove your garment and the dressings. The dressings should be discarded, and your garment may be washed in cold water to avoid shrinkage. You should shower with assistance, gently washing your incisions with antibacterial soap, patting the areas dry when done. Your dry garment can then be reapplied. You will then come to my office for your first visit and wound check. Stitches are removed 6 to 7 days following your procedure. You will experience varying degrees of bruising, swelling, and discomfort following your procedure. The extent of this discomfort varies from person to person. Remember that your experience may differ from that of other patients. Patients have many questions about sitting or activity following the Brazilian butt lift procedure. You may sit in a chair or stool following your procedure. You will be instructed on proper sitting techniques to minimize crushing your newly transferred fat and assuring its survival. After Brazilian butt lift surgery, you should only sit for up to 20-minute increments. You can get up and walk for a bit or reposition yourself if you need to keep sitting. If you want to sit in a chair, using a chair with no arms will allow you to sit in reverse. This will allow for the majority of pressure to be on the front of your thighs as shown here. The technique is also used when sitting on a stool, as demonstrated here. When sitting in a chair normally, one of the recommended pillows should be used. These pillows should be positioned underneath your thighs, so most of your weight is not on your buttocks. Massage softens the area and enhances circulation. Massage should be firm but not overly aggressive. A hypoallergenic moisturizer lubricates while you massage and moisturizes areas that can become dry or ashy following your surgery. Firm pressure may be used in a circular motion to the entire buttocks for approximately 2 minutes, as shown here. A kneading technique may be used as well, as demonstrated here. Massage will help to soften out bumps or small contour irregularities that can present after your procedure. Softening of the entire enlarged buttocks may be enhanced as well by this massage. Massage should be done 1 time per day. You should be able to return to work within 1 to 2 weeks following your surgery. This time will vary depending on the physical demands of your job. Remember, if your job requires sitting, you should use one of the recommended post-surgery pillows while at work. You may still experience discomfort and soreness. The degree of discomfort depends on how many areas you had treated with liposuction. Driving. If you must, you may begin driving 1 week following your surgery. Initially, drive for only short periods of time, 20 minutes or less. If you choose to drive, you must use one of the recommended pillows or something similar to it to minimize pressure on your newly enlarged rear, as shown here. You can start light exercise 1 week following your procedure. This means walking for extended periods outside or on a treadmill. After 2 weeks, you can increase this to include resistance training without sitting. After 3 weeks, you may participate in all exercises, but must limit the time in sitting exercises until your 4th postoperative week. Your recovery time after a Brazilian butt lift will depend on several things. An uneventful recovery requires that you completely follow all of these instructions and the printed instructions I have given you. This will ensure that you don't impede the healing process. Remember, everybody heals at a different rate, so a Brazilian butt lift recovery time varies from person to person. If you require additional information or would like to make an appointment for a consultation, call me at 702-243-9555 or go to my website at drstile.com. I've enjoyed sharing this time with you, and I thank you for being my patient.